everybody, Dr. Kristine here at Every Family Chiropractic Center. The video that I'm going to do today is going to be all about sciatic pain. This is a very common thing that we see here at the office. We get a lot of patients complaining of sciatic issues. I want to start off by going over the anatomy of the sciatic nerve because that kind of explains why we do see so many people with sciatic pain. So I'm just gonna get to my little anatomy lesson here. So why it is such a common issue in the body is because the sciatic nerve is the longest nerve in the body. It's also very large. So it's very large because it combines 5 separate nerves into one really big one. And where those nerves come from are L4, L5, and then S1, S2, and S3. So it's coming from the last 2 lumbar vertebrae and then also from 3 different spots of the sacrum. So you can see that the pain can originate in several different areas. After it comes out of those areas right here, it's going to pass underneath the piriformis muscle, which is a muscle in the butt, and goes all the way down to the ankle. So lots of areas where that nerve can become irritated or cause pain. The most common area that the sciatic nerve is actually being irritated, that is causing sciatic radiculopathy, sciatic pain, is in the low back. So many people tend to think that the sciatic problem is actually their hip, when in reality, the problem is nerve interference in the lumbars, not necessarily the hip. So when we adjust, that's why it's really important to get adjusted when you're having sciatic pain, because people tend to think that they can just stretch out the muscles, because a lot of times they're feeling the pain right here. So they will, well, right in this region. So what people will do is they'll stretch that area, they'll ice that area, when in reality, the area where the problem is starting is right here in the lumbar spine. So when we are adjusting, even though you're feeling the pain elsewhere, we are making sure that we are getting those joints moving properly so that there isn't that nerve interference at L4 and L5, which are the last 2 lumbar vertebrae in the spine. I do, though, however, want to talk about stretching and exercising because it's going to be essential in helping with sciatic issues. And the reason why is because many times when people are having a very consistent sciatic problem where it comes and goes, there are postural things going on that I can notice. So one of the most common postural abnormalities is having the head forward, the upper body is kind of sagged like this. So you can see how when I turn to my side, my head is forward, my upper body is sagged. And when you do that, the hips also then go forward. So when you have that posture, what will end up happening is you'll develop something that we call lower crossed syndrome. So what lower cross syndrome means is it's basically if I were to take an X over the side of my body, if I were to turn sideways, you'll have a cross where there's weak muscles here and here, and then there's tight muscles the opposite direction here and here. And having that cross of weak to tight helps perpetuate those postural issues that are going on. And what you have to make sure to do when I see this going on is you want to stretch the ones that are too tight and strengthen muscles that are going to help decrease that postural issue. So the muscles that are typically really tight in patients are let me get rid of this spine here, are the hip flexors. So if you have seen me for low back issues or sciatic issues, there's a good chance that I have told you to stretch your hip flexors. And later on, I'm going to go over some of the exercises that you should be doing. But hip flexors are almost always very tight. And then also the lumbar extensors. So what that means is, I'm going to show you. So your lumbars are this area of the body, right in the low back. The extensors are the muscles that are used when you look up to the ceiling. So your hip flexors and your lumbar extensors are very tight. So it's very important to stretch those. What ends up happening as a result of that is that eventually your hamstrings become tight. Those are the muscles in the back of your legs, and your lats. So your lats are these muscles here. those tend to get really tight as well. So I am going to go over the specific stretches to do for those. Let's see, the muscles that end up being weak. So the weak muscles that help perpetuate this postural issue are weak abdominals. So I'm constantly telling people to work out their core. Sometimes people think that they're strong because they can flex their stomach and they see some abs, but it's actually those like really deep core muscles that are not strong. And then also weak glutes. So that's your butt. So weak glute muscles, that's another common thing that will end up leading to that anterior tilt of the pelvis. When we have this funny posture with the head forward, sagged upper body, forward pelvis, I see this a ton in actually our teenage boys at the office. It leads to a lot of issues in the L4, L5, S1 region. So not too surprising that that type of postural problem can lead to sciatic pain because the three of the 5 nerves that create the sciatic nerve come out of those areas right there. So what causes this type of posture? Shocker, prolonged sitting is a really big culprit. When you sit in that sitting position, your hips are forward. So when you end up standing, that's where you naturally, how you want to keep standing with your hips pressed forward, and you create that lazy standing posture where you start to hunch your shoulders down. So what's really important is to make sure that when you're standing, you engage your core, because the moment you engage your core and tuck your pelvis, you're sitting or standing straighter. Another thing that can also lead to these postural issues is locking your joints. So what that means is for women especially, we have a tendency to stand and cock our hip over to one side. When you bring your hip into that end range, it's not good for your body. Also, when people stand and they lock out their knees, that's another thing that will lead to some of these postural abnormalities. Other things that can create these types of postures are your sleeping position. So not a lot of people like to hear this because I'm telling you to sleep differently than what is most comfortable for you. But sleeping in the fetal position, so really tucking those knees up to the chest, is creating an unnatural curve in the lumbar spine. So I'm going to turn sideways here, and I'm going to show you based on my neck. So your neck is supposed to, the bones go this way. The same thing goes for your lumbar spine. So if my bones are supposed to go this way and I'm sleeping like this, but with the lumbar, like you got your legs curled up, you're creating the opposite curve. Therefore, you're messing with all the muscles. So that's the ones that are supposed to be long are now shortened. The ones that are supposed to be short are now lengthened. And that's when we get those muscles that are too tight and ones that are too weak. So I want to go over some of the stretches that you can be doing that you really should be doing daily. And these are stretches that honestly, if you are not having sciatic pain, I would recommend doing it anyways, because the incidence of people having this lower cross syndrome is very high, especially in today's world. So these are the stretches that I recommend everybody do with the hamstrings. And let me just say this on the side here. I'm going to be explaining these stretches. You can go ahead and Google them, but I am going to be doing 2 other videos end of this week and then next week where I'm going to actually have somebody film me doing the stretches and have somebody film me doing the exercises. That way you can really make sure you're doing them correct. So for the hamstring, there are a couple ways that you can do it. You can do it where you lay on your back and you put one of your legs up against a wall. That way you don't have to worry about bending your back in any funny way. You're just laying on the floor. With sitting, what you would be doing is you would have your leg out straight on the floor and you're going to hinge your hips forward. So a lot of times people, when they like to stretch out their hamstrings, they go ahead and they go and grab for their foot and they curl their body forward like this. I don't want that. So you lead with your chest to create the stretch with your hamstrings. When you do that, you don't have to go very far forward in order to feel that stretch. So that's going to be a really important one for the hamstrings. For the hip flexors, for all of those yogis out there, some people have heard of the pigeon pose. I don't necessarily want you to do that. I like people to do a modified one. So just make sure you get your leg in front of you so that you're stretching it out. You don't have to have your other leg completely straight behind you. Or what I tell a lot of patients is to lay on the side of your bed, and the side that you're trying to stretch, you just hang your leg off the bed. That way you're stretching your hip flexor. And again, I know it's probably difficult to understand kind of the visual of what I'm saying right now, but I promise you I will be having a video with all of the stretches for you guys to see. For stretching the extensors, your lumbar extensors, again, this is one, go ahead and Google this one, because you can Google this one, you're going to be able to see exactly how it's done. It's called cat-cow. Yoga, people who do yoga know exactly what I'm talking about. You're just going through the motion of extending and then flexing your lumbar spine. And then one I can easily show you for stretching out the lats on this side of the body here. You're just going to do side stretches. Make sure you really feel that stretch over here. So those are all going to be really important stretches to do. Something that I really want to stress for people struggling with sciatic pain, since you feel the pain right in the middle of the butt, a lot of people like to try and massage that out. Do not lay on a lacrosse ball. Do not foam roll that area. The reason why is because that nerve is creating pain because it is being pinched, is being pressed on by the piriformis muscle, or it's already red and inflamed. When you go ahead and put something on that nerve like a lacrosse ball or really dig in there and roll it out, you are only going to make that nerve more angry. We need to fix the nerve interference above it in the low back. Don't start going away at it with something really hard that's just going to make it worse. You can ice the area, but that's it. So those are some stretches that you can do. When it comes to exercises, I told you all that the abdominal muscles, the core, are usually very weak. So strengthening your core is going to be really huge in helping with sciatic issues and low back pain. One easy thing to stretch the abdominals is to do breathing exercises. So if you sit up straight and you do deep belly breathing, where you focus a lot on breathing in as much air as you can into your belly and then pushing that air out while keeping your posture upright. People have a tendency, when we take a deep breath in and you breathe out, people will do this. So if you concentrate on blowing all of your air out while keeping your posture good, you are strengthening a lot of your abdominal muscles that are usually weak because we're not breathing correctly. Another easy exercise to do, again, this is one that you guys can Google, the bird dog. The bird dog exercise is when you are on hands and knees, you bring one arm forward into the air and the opposite leg straightens out behind you, so that you're just doing a really light strengthening of the core. Even when people have like disc herniations, I feel safe giving them this exercise. It might not feel like you're getting a ton of exercise, but you're still at least engaging those core muscles that are going to be essential in helping fix your posture, so that you no longer have sciatic issues, no longer have chronic low back pain. If you want to get more advanced, do some of the other plank exercises. Just make sure you're engaging your core, keeping your spine straight while you're doing it. Side bridge is another very good core exercise to get those muscles on the side rather than just right in the middle. And let me make sure I'm not missing a lot of them. So for strengthening the glutes, what I recommend for that is to do glute bridges. That's when you're laying on your back and you use your heels to push yourself off the floor. And squats are always a fantastic one too, because those will also be working out your core muscles. And again, I will be doing videos showing exercises, and I will be doing videos showing stretches. I do want to make sure to stress that, I have struggled with sciatic pain. It was absolutely terrible. I've never had stabbing, throbbing pain I had it all the way down to my ankle. It was terrible. So I completely empathize with people struggling with that. It affects your mood. It can make you nauseous. It can affect your ability to think clearly, to sleep, etc. So sciatic pain is absolutely no joke. Chiropractic is essential with helping get rid of it. You can stretch and you can exercise, but we need to be able to take that pressure off of the nerves and coming out of the lumbar spine. Chiropractic helped with me essentially, but I'm going to be honest here, I was a little lazy about making sure I did my stretches and exercises, and I was relying on chiropractic alone. As much as I would love to say chiropractic is going to be the only thing you need for every type of pain, you need to be doing things outside the office, because I can get adjusted and then leave the office, and if I'm still perpetuating that same posture that's not good for my body, and I keep having these muscles continue to be tight, then my sciatic pain is going to keep coming back. And that's what happened. And as soon as I got diligent about stretching, as soon as I got diligent by exercising, it doesn't have to be crazy exercises. You can just do some things to, like, very easy 10-minute things a day to get those muscles working the way that they're supposed to. It's going to help greatly with helping with sciatic pain. Another cool way that adjustments help is it just helps stimulate muscles that aren't being fired, or firing properly. Sometimes our brain just isn't connecting to our body the way that it's supposed to. So, for instance, I'll give an example. There was a study done where they looked at someone's abdominal muscles and how they were firing when they went to go grab something to pick it up. Because anytime you go to grab something, your abdominal muscles should fire. They did this to a rugby team. It was over in New Zealand. And all of the players who didn't have their abdominal muscles firing, they did one lumbar adjustment. So that's an adjustment to their lower back. They did one adjustment, retested them, and over 50% of them, their muscles started firing again. So I could be doing my stretches, I could be doing my exercises, but there could be some nerve interference elsewhere that's also contributing to my sciatic issues because my brain's just not telling my muscles to do what they're supposed to. So many ways that chiropractic was able to help me out, but it is still very, very important to have healthy habits outside of the office. That is why we do our health from home video and we do our wellness workshop, because we want you to understand that chiropractic is absolutely wonderful, but you need to be doing stretches, you need to be doing exercises outside of the office for most pain-related issues. As always, feel free to reach out if you have any questions. If it's a question about how to do something properly, just be patient. I will post some videos. And go ahead, comment on the video, call our office, send us a private message. I would be happy to talk to you more about sciatic pain, chronic low back pain, and tune in so that you can see all of the stretches and exercises that you should be doing to help. So I hope that this was informative for all of you, and I will see you next time.